Course, Pollution and Health. Module 3, Urban Health. Lesson 3.1 Salutogenic Cities and Therapeutic Landscape Design. Hello, I'm Andrea Rebecki and my lecture will be about urban health, salutogenic and therapeutic landscape design. So, first of all, together with Professor Carper Longo, I'm working in the Department of Architecture, Built Environment and Construction Engineering of Politecnico di Milano, and we are following the activity of the Design and Health Lab. The Design and Health Lab, it's a research lab that tries to study and monitor and assess all the relations between the built environment, both indoor and outdoor, and health. Also, we are trying to propose innovation with a multi-criterion and a multidisciplinary approach to urban health field, hospital design and healthy building, and also, we are trying to develop an evaluation tool able to bring evidence and experience-based design to our research activity. The Design and Health Lab explores 3 research fields. As I said before, the main one is healthcare design, and you had a lecture by Professor Stefano Carper Longo. The second one is urban health, so all the relation between the cities and the salutogenic city with urban health design, strategies and design criteria like walkability, availability of green spaces, the city of proximity promotion and universal design. And the third one, it's about healthy building, so how to promote a healthy approach and well-being into the indoor environment where we are used to live the most of our daily life. The focus, as I told you before, will be about urban health, and so we will explore the theoretical scenario first of all, and then we will move to healthy design strategies, 3 research experiences by Politecnico di Milano. So about the theory, a very brief theoretical scenario. We are living in the period of urbanization because the expectation of the United Nations in 2050 is that more than 74% of population will live in the urban area, and the cities are places of a lot of opportunity like cultural opportunity, economic opportunity, social opportunity, even educational opportunity. But at the same time, cities are places of a lot of risk factors like environmental risk factors, social risk factors, and so even health risk factors. And also we need to consider that close to the urbanization phenomena, we have even to face the elderly of population. The elderly trends that it's common worldwide. You can see in this slide the expectation of life and also the aging of population. That is rising and rising up. But even at the European level, the situation is that in the future we will have more of the population that will live the elderly age. And that means that the World Health Organization itself start to draw and to promote a lot of research program together with a lot of fun speaking about healthy aging, in particular as you can see in the top chapter 2, the green one. World Health Organization is starting to collaborate with urban planners and with designers like architects to create active environment. The reason is that our life and our health status is affected by 4 different determinants of health. The main one, 50%, is due to socio-economic factors and lifestyle. The second one, 20%, is due to environmental conditions. The third one, genetic insurance, covers 20% again, and the last 10% is due by the national health care system. So as architects, as designers, we can have a role in improving the first 2, that means lifestyle and environmental conditions. Trying to promote healthy lifestyle, the main one is the physical activity promotion that reduces sedentary. That reduces diabetes type 2, and also about the environmental condition. For sure architects will have a key role to promote, to realize, to reactivate from the social point of view, the built environment to create a better living place. And this network comes from the beginning of the 19th century, where all the main principal cities in Europe, like Barcelona and Paris, were completely redrawn to improve the urban quality and to improve the life conditions. So, it means that there was a strong collaboration between designers and public experts to improve together the quality and the features of the built environment that are capable of protecting and promoting the public health of the population living in the city. And I always like to explain this slide because it's very meaningful. I mean, we are used nowadays to call some parts of the city with medical terms. For example, if we are referring to the city center, we are used to calling it the core of the city. If we are used to speaking about the street, we are used to calling them vehicular arteries. And finally, if you are thinking about something that breathes into the city, like the green areas and the green urban parks, we are used to calling them urban lags. So, it means that this strong network between public health experts and the designers that we had at the beginning of the 19th century is underlined by our common words that we are using in daily life. The healthy city definition is something that goes further than sustainability itself, because a healthy city refers to creating better living places for people from the point of view of well-being and public health promotion. And in fact, also the Sustainable Development Goals, for example, the main one for our interest as architects and designers, are number 10 about the reduction of inequalities, number 11 about sustainable cities and communities, and number 13 about climate resilience and climate actions goals. All those three goals to Sustainable Development Goals number 3, that is speaking about global health and well-being. And that underlined a strong relation that we should have in the further year, speaking about Sustainable Development Goals and speaking about reaching a cytogenetic approach. Thank you for attention.